If you call 111 with symptoms associated with COVID-19, you might well be called back by a GP who'll carry out an initial telephone consultation. If they think that they then need to see you in person, you'll be asked to come down here to the primary care centre, where you'll be checked and possibly swabbed.
We're seeing patients with any potential COVID symptoms. So basically, normally it comes through the 111 system, or they will have spoken to a GP over the phone. And if after a telephone assessment there's any concerns that the patient sounds unwell or needs to be seen face to face, they'll be invited down to the COVID clinic to be seen by the team here, and just assess them, have a listen to their chest, check their oxygen levels, and then be given advice going on from that.
So that's a really good triage system, and it means that we're limiting any strain on our current resources as we sort of wait for that sort of curve to kick off.
They come through into what we call the dirty clinic, which is a COVID-19 clinic. And as you can see, we're all prepped up in working in this clinic because it's where most of the patients will come out positive, will be tested. We triage them, which is taking the basic observations, temperature, blood pressure, respiration rate, and we get a brief history of what's been happening to them. After that, they're passed on to the doctor.
So we're trying to limit the numbers coming, because if we just told everyone with any potential symptoms to come down straight away, we'd be inundated. So first stop is to get advice over the phone. A lot of the symptoms, if mild, can be dealt with over the phone with advice. But if the doctor or clinician over the phone thinks it sounds a little bit more concerning or would like them to be seen face to face to be examined, then they'll come down here. If it's potential COVID symptoms, they're seen at this clinic, which was completely separate to what we're calling the clean area, where any patients with any other medical problems are being seen in a completely separate area, so that we're not kind of mixing patients.
It's a dirty clinic. Most patients that come here are presenting with symptoms of the COVID-19, so the place has to be cleaned in between each patient. We make sure every single couch is clean, sterilized before the next patient is seen. So hygiene is paramount in here. The protective equipment where nurses use here, nurses and doctors alike, is with full PPE gear. We have the surgical gear underneath our PPEs. On top of the PPE, between each patient, we also change our gowns. And between each single procedure, we are changing gloves. Not only between patients, but if I start doing a swab and then I need to do a temperature, change gloves. If I need to do from a temperature, I need to do another procedure, I also change gloves and make sure I wash my hands in between all those changes. And obviously we also wear the mask and glasses, which are paramount.
They will get a full doctor's assessment here, and if we feel that they're meeting their criteria to be tested for COVID, then we will test them.
We use a swab, which initially goes down the throat to the very back of the throat, and then we have another swab which goes into the nose to the very back of the nose. It's quite an uncomfortable procedure, not painful, but uncomfortable. And then we send it off to the lab to be processed.
So we've got a list of symptoms, the ones that can be found on all the kind of public health information, and depending how many of those symptoms you meet, then we'll decide, and depending how unwell you are when we see you as well.
Regardless of whether or not they meet the criteria, if they're having respiratory symptoms, we are still advising them to self-isolate.
In this pandemic, the GHA's model is to keep people away from the hospital if possible. For those who do come here, doctors, nurses and their support teams are taking precautions to limit the chances of the virus spreading.